Well, hello. My name is Dr. Kenneth Chern, and I've been with Seaview Orthopaedics for approximately 17 years or so. I started out my education in northern Jersey in Morris County. I went to Whippany Park High School, and subsequently went to Princeton University. And then after that, I went to medical school at Columbia University in New York. I think I first decided to go into medicine in high school. I was a good student and a little bit of a geek. I like studying, and that naturally landed me in medicine, because at that point in time, even early on, I saw medicine as a field where you never stop learning, and the more that you learn, the more that you study, the more you're able to help your patients. Well, I decided to go into orthopedic surgery while I was in medical school. During our clinical rotations, I found that the orthopedic residents were probably the happiest residents of all the residents I worked with. They were just happy about what they did. They got to work with their hands. The problems that they were treating seemed to be very concrete problems with real solutions. And I think that immediate gratification of getting somebody better was what ultimately attracted me into orthopedic surgery. In terms of what I like to do in my free time, I like to keep active. I'm also an avid fisherman. I do a lot of deep sea fishing. There's just something very relaxing when you're out there in the middle of the ocean surrounded by water, and there's nothing better than fighting a fish for an hour and reeling them to the boat. I also enjoy playing around with my kids. They seem to keep me young when we run around and chase after them, so that's kind of what I do in my free time. I've seen it grow from several man group to almost 20 doctors now, and we all interact very cordially. We get along, and we really, on a professional level, help each other take care of patients. We have every single specialty in orthopedics represented. So if I have questions or issues with a patient that's difficult to treat from an orthopedic point of view, I always have a colleague that I can bounce questions off of, and we just really help each other, and it's a good environment to work in.